In this video, we'll guide you through disengaging your first Smartwire. Before getting started, let's briefly review the Smartwire disengagement process. There are two different methods to disengage the Smartwire that we'll review. The first method uses the InGager dental instrument, the same instrument used for Smartwire engagement and will be covered in this video. The second method uses the Smartwire plier, which will be covered in the next video. The InGager has two ends, the angled end and straight end, where they are typically both used for disengagement. In general, the angled end is used for posterior teeth and the straight end is used for anterior teeth. To disengage a locket from the bracket with the InGager, apply force to the neck of the locket using the InGager to compress the locking spring, which allows the shoulders of the locket to pass underneath the occlusal tabs and rotate out of the bracket. Just like with engagement, the proper angulation is critical for disengagement, where the InGager should be centered between the occlusal tabs and run parallel to the long axis of the bracket. In the buccolingual view, for posterior teeth, the InGager should be angled approximately 20 degrees from the long axis of the bracket. For anterior teeth, due to the anatomy of the tooth and design of the bracket, it isn't possible to hold the InGager at a 20-degree angle of inclination. So for anterior teeth, instead orient the straight tip of the InGager as close to the tooth as possible, actively pressing the InGager against the lingual surface of the tooth. We will now begin the exercise to disengage the Smartwire with the InGager. If needed, pause this video to retrieve the upper ideal model with the engaged Smartwire and InGager and a lingual Weingart plier. Orient the model again as if working intraorally from the 12 o'clock position, with the upper anterior teeth closest to you and the posterior teeth farther away. With your dominant hand, use the angled end of the InGager with a modified pen grasp and interlock the InGager with the neck of the locket of the first premolar. Gently rock the instrument to ensure a secure connection with the neck. Confirm proper positioning. The InGager should be centered between the occlusal tabs and angled 20 to 30 degrees toward the gingival and slightly lingual direction. Once properly positioned, use a finger from your non-dominant hand to apply force to the bend of the InGager, disengaging the locket in one smooth motion. If disengagement does not occur, first reassess your positioning and angulation, and then apply more force on the next attempt. Continue using this same two-handed approach for the remaining posterior teeth. For the anterior teeth, flip the InGager to use the straight end. Maintain a modified pen grasp with proper fulcrum support. Interlock the straight end with the neck of the locket and gently rock to confirm a secure connection. Position the straight end right up against the tooth, push gingivally first, and then roll the locket out lingually. Repeat this same sequence for the remaining anterior teeth, where you'll interlock, position right against the tooth, push down, and roll out. This completes disengaging your first Smartwire. We recommend re-engaging and disengaging this Smartwire with the InGager a few times until you feel comfortable with the technique, and then leave it engaged in preparation for the next video on disengaging with the Smartwire plier.